was the infamous French mental asylum, wherein people with mental health illness were isolated, they were caged, they were chained, and normal civilians would pay an entry fees to watch their horrors and enjoy their erratic behavior of deviance. In all fairness and honesty, the first mental asylum was a zoo of mentally ill humans. One of the earliest documented procedures to treat mental illness included drilling holes into the skulls of people that would let the evil spirit out of their bodies. From these dark ages of mental health, the humanity has come a long, long way ahead. But yet, the stigma regarding mental health still prevails, hiding the mental illness. We at the Department of Psychology, Shet PT Mahila College, Vanita Vishram, feel very strongly regarding mental health awareness and take it up as our purpose of being. And as part of this purpose, today we are here to celebrate the World Mental Health Day. And I, Departmental Coordinator Aditya Farsole, take great pleasure to welcome you all with all my heart and soul. Carl Jung, in his collective unconscious, has defined it as collective mind shared by beliefs and instincts common to all of human race, and one of them being our belief in higher power. So let us all take a moment to pay tribute to our belief in higher power. Ms. Bhumi.
शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपनमोऽस्तु ते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश मतिं स्वच्छां हि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठे गृहे दीपः तस्य नास्ति दरिद्रता शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः
Vanita Vishram, our parent institute, was established in the year 1907 with a vision to empower women. Mental health plays a very important part of this vision. So I welcome you all to this international webinar and I thank you for your participation. I now request my colleague and friend, Ms. Riya Nadkarni, to introduce our resource person for today, Dr. Gayatri Salunke from Freiburg, Germany. Over to you, ma'am.
Good evening, everyone. I take great pleasure in introducing our resource person for today and my friend, Dr. Gayatri Salunke. She is a dedicated researcher in psychology and has extensive experience in project management, data analysis, and scientific writing. She has many international publications under her name. She pursued her BA in psychology from Fergusson College, Pune, and completed her MSc in Foundations of Clinical Neuropsychology from Bangor University, Wales, UK. She pursued her PhD in clinical psychology from the University of Freiburg, Germany. She is currently working as a technical officer at MSc Global Urban Health Program, University of Freiburg, where she conducts lectures on various topics, including global mental health. Her strengths include interpersonal and scientific communication, and she enjoys working in interdisciplinary and international environments. Her long-term goal is to develop and implement mental health care programs for countries like India and for minority groups in Germany. I heartily welcome you and look forward to your session today. Over to you, Gayatri.
Thank you so much, Ria, for this lovely and kind introduction. I must say the honor and the pleasure is all mine to be here on World Mental Health Day and to talk to you about a topic that I'm so passionate about, global mental health. I hope that you can see my screen now. Okay. So today's topic is mental health for all. And as Ria kindly mentioned earlier, I've been working in the field of global mental health. So what is global mental health? For that, we have to take one step behind and ask ourselves, what is global health? Global health is an area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. So when we say the topic of the day is mental health for all, we are talking about achieving equity for all, achieving a balance in the imbalance that we know exists in different parts of the world. So when we are in the field of global mental health, we have two critical challenges. The first being the disparities between rich and poor countries, where we know that there is a clear difference in, for example, access to mental health and mental health care. And we also know of the disparities between physical and mental health. Unfortunately, this is the case that whenever we're speaking of mental health, we're somehow competing with the physical disorders. It's always more powerful and has somehow more impact when we've broken a leg than when we're mentally suffering. So we have that challenge also to fight. So what's the first thing you think of when you hear the words mental health? This is the question that I posed to my classroom of students. And the responses that I got were so diverse. Some of them said depression, anxiety, schizophrenia, stress, distress. Some of them also said happiness, well-being, eating healthy, sports, family, friends. And indeed, mental health comprises of all these various diverse aspects. What does the World Health Organization, or the WHO, define mental health to be? So the WHO says that mental health refers to the capacity of thought, emotion, and behavior that enables every individual to realize their own potential in relation to their developmental stage, to cope with the normal stresses of life, to study or work productively and fruitfully, and to make a contribution to their community. So as you can see from this definition itself, nowhere in there do we have the words disorder or stress or disability or the lack thereof. When we speak of mental health, we speak of optimizing life, optimizing quality of life. And this is our goal when we speak the words mental health for all. This is where we want to get to, correct? So when clinicians are working in the field of mental health, we have a variety of different topics that we deal with. And when we look at it clinically, we look at it in a slightly more categorical approach. So broadly, if we want to categorize the different types of mental health disorders, we would come and find that there are about 3 syndromes. We have anxiety-related syndromes, we have mood-related syndromes, and we have psychosis-related syndromes. But mental health, as we said, is not just related to disorders and ill health. In fact, we want to get to well-being. This is something that you and I want to achieve in mental health for ourselves as well as our societies. However, both you and I am very sure, have had days or periods when we struggle and we might have difficulties, let's say, for example, with our sleep, with, say, lack of energy. We worry a little too much when something's going wrong. And so we might indeed fall into periods where we're having mental distress. Sometimes, if it's a tricky point of time in our life, we might even have heavier symptoms. We might even have, too much fatigue, too much worry, lack of energy. You have days where you can't get out of bed. And if it's a period where you're having extreme struggles like this, it might be worthwhile to get some early care and avoid that this situation worsens and that you actually do end up maybe having a mental syndrome. Yeah. So the point here is that in the clinical setting, we work with a categorical approach. Often we're asking ourselves the question, so what is the disorder? What is the problem that this person has? And we want a clear answer. It's kind of similar to the corona testing right now. Is it positive or is it negative? And this categorization is actually not reflecting the reality of the situation in mental health, because in fact, it is a huge dimension. You and I and everyone falls somewhere on this spectrum. And the position that we take on this huge spectrum can differ from day to day, from period to period in our life. And this is very important to keep in mind when we are thinking of mental health. It might also help us to remove some of the stigma that is attached with mental ill health. And while I try to underline the importance of this dimensional perspective, I do not want to dismiss the importance of the categorical approach. So the reason why clinicians work with this categorical approach is because it can help us to prevent disorders, to treat or give care in case somebody is suffering. And so we do need categories, no doubt. But when we think of it on an everyday basis, whether you're a clinician, whether you're in the field of mental health, or whether you're not in the field of mental health, it is important to keep in mind that it's all dimensional and that we all lie somewhere on this spectrum, and this can change from one day to another. All right. So why has mental health been so sidelined? Unfortunately, we often hear things like, mental health, this is the medicalization of social suffering. Back in my grandparents' day, or back in, in the previous generations, nobody spoke of the things like depression and anxiety. This is something that's coming up new. It's the new generation's way to struggle. And it's probably related to the pharmaceutical industry who wants to make more money off of this. Or people say things like, it's a problem of the worried well. For those of them who are doing so well and have nothing else to complain about, then they start thinking about these mental difficulties. Or people say that this is a Western construct. So I have done my PhD on the topic of attention deficit hyperactivity disorder, or ADHD. And I've come across papers and studies in which there are debates about whether ADHD is an American syndrome. And of course, the issue of stigma that we all face on almost a daily basis in our life. We're all ourselves scared of, I don't want to expose anything if I'm having some mental difficulties or psychological difficulties, because people might call me weak or crazy or mad. And these words are really harsh and really inappropriate, given that we all lie somewhere on the spectrum, somewhere on this dimension. And then we have it. Mental health is not a killer. So we have, oftentimes we have heard that, okay, if somebody is, physically struggling, if they've broken a bone, or if they have a cardiac arrest, then this is serious. Indeed, it is serious if something happens to one physically, but it is just as serious and just as important to address psychological difficulties. I want to take a step back to discuss this issue about, when people say that mental health, this is for the worried well, or is it a Western construct? And to do this, I would like to look a little carefully at the global burden of mental and substance use disorders. So now we're looking at it in the global context across different types of countries. This image is a little confusing or a little complicated, let's say, but I can walk you through it. So on the x-axis, we have the years over a period of about 15 years. And on the y-axis, you see the percentage of total disability adjusted year lives, which very simplistically might refer to social suffering, to psychological or social suffering that one has when they're struggling due to a disorder. The red line refers to countries that have a high socio-demographic development index. Yeah, so perhaps high-income countries would fall into this red category. And a country like India, this would be a country that falls in the gray line. That would be a low and middle income country, or a country with low and middle socio-demographic development. And what we can notice if we look at this graph carefully, comparing the red and let's say the gray line, or looking at all of these lines together, is that since 1990 and until the recent years of 2016 or so, it looks like there's a trend moving upwards. So you'd ask yourself, is it really the case that nowadays we suffer more than we did maybe a decade or 2 decades ago? And if we compare the gray line with the red line, is it really the case that the countries that have a higher social demographic development, are they really the ones suffering more? These kind of data suggest, or if they're misinterpreted, then they might suggest that, oh yes, these mental disorders are a problem of the worried well. We are coming up with this in our new generation. Or it is a Western construct to think more and more about mental health. And it's a luxury product that, low and middle income countries, we don't have this. But we need to think a little deeper right now, and we need to question such data more critically. Thankfully, over the past couple of decades, there has been greater awareness about mental health. And due to a greater awareness, it might be likely that we are diagnosing more disorders. This could reflect in these trends that are going up in the past couple of years. Also, on the y-axis, the disability adjusted life years, this is a relative term. So in the past, let's say 2 decades ago, we were struggling more with, let's say, infectious diseases, with communicable and non-communicable diseases. These were killing more people several decades ago than they do now, because now we have good medication, we have good treatment to tackle those communicable and non-communicable diseases. We don't have as much advancement in the field of mental health. So while our numbers might go down for communicable and non-communicable diseases, then it allows more space to reflect the struggle that we're facing in mental health, in the field of mental health. And maybe that's also reflected in this rise over here. Also, when we look at different countries, for example, India is amongst the youngest of countries globally, whereas Germany, a high-income country, a larger part of the population is aged. And this might also reflect in the differences between high and low or middle income countries. And this is something that we should keep in mind when we hear things like, are these problems coming from the West? Are these problems more for those who are actually well-to-do? Because we need to analyze these statistics more carefully and look at what factors might underlie them. And as I said before, one of the biggest problems is where people put up their hands and say, a mental disorder is not going to kill you. It's nothing like a physical disorder, because those are the ones that kill you. So here's a graphic of numbers of death by cause according to the global burden of disease in 2017. And indeed, if we're looking at the numbers of death by cause, there's no really big number for mental disorders. Depression is not seemingly in this list. So people would say, yeah, what's the big hype? Why are you asking for, let's say, more funding for mental health if it's not killing us? But here again, we need to ask ourselves the question more critically. Let's look, for example, at cardiovascular diseases. This seems to be the biggest killer. Now, you can imagine that somebody who has a very high level of anxiety, a stress-related disorder, they are likely to have high blood pressure because the mind and the body, they function together. And it is important to think of links, such as the link between anxiety, high blood pressure, and potentially in the long run, cardiovascular diseases. Fifth in the list, we have dementia. Dementia is indeed a mental health related to aging, a mental health related disorder related to aging. Next in the list, we have digestive diseases. You might ask, what's the link between digestive diseases and mental health? Well, again, if you have high levels of, for example, anxiety, you might have a higher susceptibility to getting, for example, gastric ulcers. And upon the lack of treatment for the underlying mental health problem, if this worsens, one could easily assume that this could lead to worsening digestive diseases. And if digestive diseases are killing people, then what's the root cause thereof? It doesn't always have to be the case, but this might very well be the case for at least some of the patients. Here, not far down the list, we have liver diseases. Again, it's not far-fetched to imagine that somebody with a liver disease is substance dependent on alcohol. And if this is the case, then it could be that liver disease arises after a couple of years. And substance use disorders indeed falls under the category of our concern in mental health. Road injuries. Now you'd say I'm being really far-fetched. But for example, patients with ADHD have been found that in young adulthood as well as in adulthood, they are far more likely to meet with accidents, with road traffic accidents, for example, due to maybe symptoms of impulsivity. Also, on the other hand, aggression could lead to, such outcomes like road traffic accidents or accidents in general, or getting into conflict and then getting into violent activities. And those could be causes for death later. HIV/AIDS. Again, what's the link here, you might ask? If we think carefully, then somebody who has a high level of impulsivity might make risky choices. They might have unprotected sex, and this might lead to the contraception, or at least higher susceptibility to getting HIV/AIDS. And that is a disease that we know can risk one's life. Suicide. This is an interesting one because there's a lot of debate about whether suicide is actually related to mental health. But if we do a little more research on this, then the chances of somebody who has taken their life by suicide, having been depressed or having had some mental health disorders, might become more and more clear. Parkinson's disease, a neurological disorder. We have several nutritional deficiencies. These might be related to eating disorders, which again comes under the category of mental health disorders like or diseases like anorexia and bulimia could terribly be deteriorating one's nutritional systems. And then down the list here, we also have alcohol use and drug use, again, coming under the concern of mental health. So what I'm trying to say here is that when somebody says mental disorders are not killers, we need to be a little careful and critical in our analysis, because even though they might not stand high up in the list over here as disorders by themselves, mental disorders attribute to and coexist with various other diseases that are obvious killers, as we see in the statistics here. Okay, so I want to quickly show you a graph which reflects the lifespan patterns for mental and substance use disorders. I am aware that many of you joining us today are not necessarily in the field of mental health, but it's very important to bear in mind what the different disorders or the susceptibility or the suffering related to disorders are like over our life course. Now, it might strike you as a little surprising that during adolescence and young adulthood, that's the time when we have the largest peak for mental and substance use disorders. After that, the suffering reduces and reduces into later adulthood. But later, as you see with these red plots, the dementia-related diseases and the suffering or the susceptibility thereof increases in late adulthood. Down below the gray bar plot, you can see again, so self-harm, these are plots for self-harm, and you can see clearly here that this again is peaking in young adulthood. And I think that these patterns are very important to keep in mind, because one might think, oh, this person is so young, their whole life lies in front of them. And why are more young people suffering from mental and substance use disorders? Or why are more young people suffering from acts of self-harm? And of course, we know of the trends of dementia picking up later on in life. But these things are very important to keep in mind, whether you're working in the clinical setting or whether you just have friends or family that are in a particular age group. And we just need to keep our eyes open so that we're not overlooking something and try to seek out for early treatment if we feel like there might be something of concern back there. Now, this point of self-harm, that includes acts of suicide. And this is a very uncomfortable topic, but I would like to address it here because it's also quite pertinent given the current discussion, even in the media in India, about this topic. In India, suicide is the leading cause of death for young Indians between the ages of 15 and 29. The leading cause for our young adults. It leaves behind road traffic accidents, all types of communicable and non-communicable diseases. And this is an alarming statistic. Now, this age group, within this age group, you'd wonder, why is this happening? Well, adolescence and young adult years are very critical. And I know that many of the listeners on here today might lie in this age group. You might know of other people who are in this age group. And suicide, of course, is the saddest loss that we can have. But there are several indicators for suicide well before, and we need to take the opportunity to talk to one another about psychological distress so that we can avoid and reduce this alarming and shocking and very sad statistic that we have, particularly in India. All right. So our topic for today and our goal, for all of us is mental health for all. How far are we from achieving this? So let's take a look at the treatment gap in high-income countries and in low and middle-income countries. Even in high-income countries, the treatment gap lies at about 50%. This means that in a room full of 100 people requiring treatment for mental health, only 50 of them would get the care that they deserve. In low and middle-income countries, such as India, this statistic shoots up to 90%. This means that in a room full of 100 people needing mental health care, only 10 of them will get the care that they deserve. So the simple answer is we're far from achieving mental health for all at this point. According to the WHO, the standard reference per 1 lakh people should be that we have 1 psychiatrist, 1 clinical psychologist, and 2 social workers. We have a deficit in India. But how large is this deficit of mental health specialists? We lack psychiatrists by 77%, clinical psychologists by 97%, and social workers by 90%. So clearly, we are lacking the specialists to get access to care. So how can we solve our problem of making healthcare available to all? Well, the simple first thought would be we need more funding for mental health. Let's take a look at how much donor financing has gone into the field of mental health globally. Now, this study shows the statistics in US dollars in billions of how much money went into, for example, HIV, maternal and child health. And it is this purple line right at the bottom that reflects the amount of funding that went for mental health in the past decade. And so what the simple answer here again is that we have a problem. We don't have enough access to care. We don't even have enough money. And so how do we achieve this goal of mental health for all? There are 4 key points that I would like to reflect and talk about in the next few minutes. The first way in how we could achieve this a little step by step would include the actions of task sharing. So what is task sharing? Task sharing refers to moving specific tasks where appropriate from highly qualified health workers to health workers who have shorter training and fewer qualifications in order to make most efficient use of the available human resources that we have. So here is a pyramid that is proposed by the World Health Organization for what public mental health services should look like. When we talk about psychiatrists, psychologists, psychotherapists, these are all the specialists that we think of when we're thinking of critical cases and getting treatment for critical cases. It is known that there is a limitation in the number of specialists that we have in India. And we also have a limited number of mental hospitals. And in fact, this is also not a surprise because the frequency of need for absolute specialized treatment should get lesser when it's a more and more critical or a heavy disorder. It's also very difficult to say there should be a larger number of mental hospitals opened up and a larger number of specialists opened up to solve our entire problem because specialists are expensive and hospitals specializing in such topics are also expensive. So what we could do as a next is to strengthen our mental health services provided by general hospitals and by community healthcare hospitals. This is what we could do. We can also train our general practitioners, our primary mental health services could be strengthened. So for example, the GPs that we go to, our family doctors, they could be trained a little bit in mental health care and their capacities can be increased. Next, we could engage our communities. India relies so heavily on a collectivistic culture and we have very strong community mentalities. And it is this that is our resource. And if we engage our communities more, this is a very important resource that we can't afford to lose. Right at the bottom of the pyramid, we have self-care. So you and I, we're going to get nowhere unless we take care of our own mental health to begin with. But self-care is something that must, all the way up the pyramid, we also need self-care. And as I said before, if we're working hard on the bottom parts of our pyramid, then we're taking care of services in the frequency of need. So not everybody needs to go to a psychiatrist if they're facing a small level of distress and need just some support. Then maybe somebody in the middle of the pyramid, the general practitioner, maybe somebody else who's received some amount of training could also be able to help them enough to reduce their problems. And also this way we can make use of the people that we have at low costs. All right. So I already mentioned some of these examples of task sharing. One of them was capacity building of healthcare professionals. So this is this layer in the middle of the pyramid where we could train doctors, for example, in patient-centered communication. Doctors are very good in identifying various somatic problems, but as soon as they might notice that there's a psychological element to the issue, then it becomes a little difficult. And what we could do through some task sharing and in training or capacity building is to train doctors who see patients on an everyday basis to also talk to them in a way such that they can detect mental health problems and also provide maybe some basic care for that. And the strength in training doctors but also nurses or social healthcare workers is that so many of the patients who would need also mental health services are anyway going to the doctor and anyway saying that I have a stomach ulcer, I have high levels of stress, and a doctor could easily make the connection within this. Often patients are themselves not willing to go to a specialist for mental health services just yet, and so the doctor, the general professional, the GP or your family doctor, could already start to talk to you in a trusted environment and give you some levels of care there. We could also look at the lower level of the pyramid, as I said. So we have the doctors and the healthcare professionals up here, but also the community, and engage people from the community into task sharing activities. So this could be somebody who you know from your community who has good interpersonal skills and is then trained in detecting some basic psychosocial difficulties and giving some basic tips on how people from his or her community could cope with these issues better. The advantage here in working with community healthcare workers is that they already know the context. They already live in the community. They know the problems that their neighbors must be facing. There might be a certain level of trust. These are things that maybe a specialist who sits far away, maybe in a different city, would not be able to fathom. And so we have a huge asset in community health workers and in engaging them. That being said, also people who are community healthcare workers, for them, this is a huge advantage to get some training. It also builds onto their identity when they get trained and can give back to their community a little more and get some respect from their community. Another form of community healthcare could also be nightline services or calling, or communication over telephone or apps or something. So these are the different forms and methods that we could engage more and other people, increase capacities of people apart from our specialists, and get them to also support us in achieving care for everyone. Another possibility to strengthen our healthcare services is to use more digital tools. What better time than right now in this unusual corona pandemic to be talking about digital tools? We've all seen how very helpful they are. Some of the advantages of digital tools are that most people these days have smartphones because they're relatively cheap. And these smartphones can be used anywhere. So you could, as I said before, oftentimes the specialists, they're all concentrated in urban areas. So we have several specialists in Mumbai, in Delhi, and in the larger cities of states, but we don't have them in rural areas. So it could be an opportunity to use something like apps or telecommunication to reach out to people who don't have access to specialists, for example. And since it would be an app on your smartphone, they can be used at any time. But there are also some challenges about digital tools that we ought to keep in mind. Many of these apps are not scientifically grounded. These days, it's so easy to make a homepage, a web page. It's so easy to make a mobile application. And these are just floating around. There's so many options out there. What we need to do is we need to ensure that the apps that we actually recommend to people to use, these are scientifically grounded. And this we can do only if there is more research to show that these apps are reliable, they actually improve in mental health, and that's the way forward if we want to keep using digital tools. Of course, we still have the challenge of technology. Not everywhere do we have strong enough Wi-Fi that we encourage people to work with apps alone to improve the health situation. Also, many of these apps have noticed that they're all, very often in the English language. They very often have pictures or use language that is not relatable for the person who might be using this. So it's very important, let's say, to also have apps in Hindi, in Gujarati, in Marathi, in the local languages, showing faces of people who look like they're from that community, so that it's relatable not only for us youngsters to use, but also maybe somebody in their, late 60s or our grandparents. If we want to encourage them to use apps, it should still somehow be relatable for them to do this. And last but not least, as much as we love our digital tools and Zoom and apps and technology, the human touch is missing. And studies have shown that over some time of using apps, the likability of the user reduces and they stop using the app because they miss the human touch to it. So it's very important to still ensure that we have interaction with people. Maybe the app can be linked with calling the person in case of difficulties. It can be linked with also meeting a specialist if necessary. You saw this graphic a little bit earlier, and we know that everybody lies somewhere on this dimension. So what we need is really balanced care models for every stage of the spectrum. And what I have here is an example of a balanced care model for young and children and adolescents in the school setting. For example, if there is somebody who's suffering a lot and already has, specialized a difficulty, which is related to a syndrome, then they will need high intensity counseling. And so maybe there needs to be a psychotherapist or a specialist for a small proportion of the people. Nevertheless, there might be a few more who aren't needing that high level of counseling, just some low intensity problem solving counseling, which can be given, for example, also just from the school counselor. This would suffice. Then we have maybe even more people who generally would prosper from having some life skills training, some skills in how to deal with their stress better, problem solving training. And this could again be given by either a smartphone, an app, or a lay counselor. So again, you don't need specialists for everyone. Of course, we need to work on mental health awareness even in the classroom setting. Here, teachers can be trained a little bit in how to generate awareness and, demand for a mental health care if this is required. A student or a child should not feel like ashamed to reach out for help, and the only way that we can work on that is if we've generated enough awareness in a large part of the population. And the whole school climate, the whole and entire school needs to promote mental well-being, and this is the duty of the entire school. So at this stage we could think of putting up posters in corridors in schools which speak of mental health, which speak of maybe people who face mental health problems, so other students don't feel excluded. We could think of putting post boxes in schools where children can put in notes anonymously on which they can write about the troubles that they have. And maybe this can be anonymously addressed in a school meeting or something like that. So what I'm trying to say here is that we know that all of us lie somewhere on a dimension. And in every public health system, such as a school for young children and adolescents, this sort of a model would be really helpful to address problems for all people or ensure that there is well-being for people on all edges of the spectrum. And the fourth and the final possible innovation that we can use to address the mental health issues is, of course, engaging our communities and raising awareness. So these days, a lot of us are using social media, Facebook, Instagram. All of these are portals where we post pictures, but these portals are very useful to also raise the topic of mental health, raise the, the issues that we have, and it's okay, baat karo. And not only social media, which is all virtual, but we can also have more events where people can come together, where people who are facing problems can sit face to face in front of one another and talk about their problems and feel like they're not the only ones dealing with these issues. It's very important in public health to also engage the media, to also have healthy journalism. And some movies can leave a big impact on us, just leaving a short message of it's okay to not be and not feel perfectly well all the time. So movies, books, radios, newspapers, news channels, you have such a big duty actually in journalism with how important topics are communicated. And we need general collaboration in mental health with media in order to get the important messages out there. And finally, but very importantly, personal narratives are so important. In order to talk about stigmatized issues such as mental health, we need people to speak up if they're facing problems themselves. So in India, Deepika Padukone has herself opened up a foundation against depression, has spoken about her self-experience with depression. And this is so important that we have some people coming up as mascots to say that it's okay, I face this as well. It's a little bit of a pity if somebody then raises the question of, she's a successful actress, she has everything, why should she feel like that? And now we should really think of those topics like mental health is for the worried well, mental health comes from the West, and step back and think a little bit more respectfully towards those brave people who speak up about their mental health difficulties, and give them a moment where we actually believe in them and don't just be skeptical about what they're saying. This is the time to believe one another and for us to come up and talk if we have problems, or for us to create conducive environments for our friends and family in case we know that they are struggling, in case we know that they need somebody just to talk to and not to be critiqued or, to judge them. And I think that's very important to engage our communities, our friends and families. So our topic for today was mental health for all. And our goal is really to leave no mind behind. But because we know that there is, at the moment, we are far away from our goal, we have little money, what we need to do is we need to be more innovative, and we need to work with the resources that we do have. We need to work with the people that we have. We need to work with the apps that we have. We need to engage our communities, and we need to ensure that there's mental well-being for everybody on the spectrum, including you and me. Thank you so much for your attention.
Thank you, Dr. Gayatri, for such an engaging session. I would now request my colleague, Riya Nadkarni, to please take over for the question and answer session.
Thank you, sir. Gayatri, truly it was a very enlightening and a really thought-provoking session to really think about so many things. And I loved the part where you spoke about how physical illnesses actually can have an effect because of the psychological aspect of it. Right. So talking about that, we are currently in the pandemic, coronavirus, and we've had lockdowns, and now we're having unlocking. So my first question to you would be, and this is from Sneha Shenoy. She's asking that how do you foresee the impact of the corona pandemic on mental health?
Okay. Thank you for this very important question. The corona pandemic came up with this term of social distancing. And the term social distancing is a little, again, challenging or concerning, because it is not really that we have to be socially distant.
Yeah.
What we have to be is physically distant. In fact, one of the major factors that contributes to ill psychological health is social exclusion. If somebody is living their disorder alone, then the chances of this worsening is higher when they're excluded from the society. So, what we need to do in this period, even more so than usual, is to stay socially connected. So, here maybe we jump back to the point of engaging all the digital technologies that we have, and to stay connected with our friends and family, and to ensure that we're all with each other. We have a big fear for the virus, and rightfully so. But in these times, we should not forget about the acute mental health problems that are going to come up, and also the various problems that will stay with us for years to come. So it's not just during the time of pandemic, but also in the years to follow, in the months to follow, when things hopefully reside, that we actually think deeply and critically about the mental health of our partners, friends, and family.
Right. So mental health will play a very crucial role in the post-pandemic and post-corona times.
As
Yeah.
well, yes.
All right. All right. We have another question in our chat by Vaishali Khare. She wants to know whether the skills shortage in India is, she's talking about that it's really shocking. So, is it possible to reduce the therapy costs for commoners? And are Indian companies working towards solving mental health care problems?
Mm-hmm. That's a really good question again. Thank you. Um, I think the way to reduce costs is really through task sharing. So, if we would expect specialists to provide services, then these are the people who've studied maybe psychotherapy for years, and then can provide it to only a small subset of people. And sure, then their charges would not be something that might be affordable for everyone. But what we need to focus on is, if we increase the capacity of people who are working in general hospitals or in the communities, then maybe they can take on a bulk of the load which is related to mental health. So the not so acute problems, when any of us are facing not so acute problems, we could go to a general practitioner and maybe have some input from this doctor or this community health worker, and then our needs are even taken care of. But it's only when they're acute problems that we need to go to the specialist. And if we actually follow this pyramid, or try to build this sort of a pyramid, I think it would take care of the issue of people not getting to reach the specialist. So that is access to healthcare, as well as the costing.
Yeah, and so you do believe that community healthcare programs, more community healthcare programs, would be beneficial to the people?
I do think so. I think so. And I think that it might not be standalone that a person just seeks help from the community. It could be a combination of them all. So you could have an appointment with a specialist, and next to it, self-care, next to it, community healthcare services, having group discussions with people who face similar problems like you in your city. These sort of add-ons could really reduce costs.
Right. Thank you. Um, Now we have, since we're talking about global mental health, right? So there's a very good question about, do you believe that the collective sense that we have in the East, right? We're all very collective. And compared to the individual sense that is there in the West, do you think that plays a big role in mental health?
There's a good question, and a whole range of studies on transcultural aspects of psychosomatic medicine and mental health. I think that definitely man is a collectivistic animal, be it East or West. We all need our family, friends, and social support. And the way, or maybe the amount and the nature of the connection is a bit different depending from culture to culture. So definitely, I think and I would like to add here, when we have a project, for example, there are a lot of projects that the global north brings to the global south and tries to implement similar projects there. And we need to be really careful that we're not copying and pasting the projects that take place in, for example, Germany, in India. But we need to adapt it in a way that is acceptable to India, that fits with the culture. And here I think that the collectivistic aspect is something important to keep in mind when we're tweaking projects and making them acceptable.
Yeah, that's true. Because even when we do psychological testing, it's very important to understand that culturally we are very different from where the test is made. Yeah, so absolutely.
Absolutely. Yeah.
Right. Okay, there's another question that that's personal basically for you, is that having lived in India and in Germany, do you think that mental status is different in both the countries, or can we compare them, or it's absolutely different?
Mm, there are indeed differences. I do feel like the access to healthcare is a bit better here. In one of the slides that I showed, I can see that while in India it's the treatment gap is about 90%, here it might be about 50%. They in Germany, for example, they really do have doctors who are trained in basic psychosomatics, training and so forth. And there are areas within the country similar to India, very similar to India, where the topic of mental health is discussed openly, it's accepted, and this is more in the urban areas. In the rural areas, I've spoken to some specialists even here, and they say, no, the acceptance of, mental difficulties, mental illness also is still not as advanced in the rural areas. There's less acceptability. So there are commonalities and differences.
So globally, mental health is still a fight that we are fighting. We have to still go towards it. Right?
Absolutely. Yeah.
Okay. There is a second grade teacher, Rinal Akhiani, who says that how can I assure my students that they are mentally fit? I have another question related to that. That there is a lot of pressure these days. Students are facing a lot of pressure. It could be peer pressure, or academic pressure, exam pressure. Do you think that a subject related to psychology or having talks on psychology and mental health would be beneficial for the students since from a young age?
Yes, absolutely. Thank you so much. I think we are a society that is very success oriented. And with when I say we, I mean actually globally. This is the truth, that be it academics or be it even sports. Sometimes we say, no, like, to balance out the academic pressure, one should play sports. But then again, there's that pressure of, okay, the child now needs to be the best at this. And what I think is a subject in mental health would indeed be wonderful. As a psychologist, I would be all up for that. But what's very important is maybe just the training of maybe parents as well as school teachers in using words like, use this opportunity and use this safe space to explore what your talents are. And it's okay to fail, and it's okay to just give things a shot. I think it's just really important to watch our language as especially with children, because childhood trauma and childhood experiences are in fact, again, one of the biggest factors that impact mental health later on in the life of a young adult. So it's very important that we watch the language that we use. And as a school teacher, Mrinal, I really do think you have such an important and lovely role to play on the minds of people. So I would just maybe point out, the importance of the language that you use at schools and at homes has everything to do with the child's mental health.
Yeah. And you having said that the language is so important, and not just the words, but the tone in which we say certain things are so important for a child.
Absolutely.
Yeah. All right. Okay. Nowadays there is a lot of issue, and you did speak about it. You did speak about suicide being very, very prevalent in India currently, and we have seen a lot of celebrity death And after that, we have seen a lot of other people imitating that kind of behavior, thinking that if he can do it, then I can do it. Right? So, is that an issue that's going to impact the youth of our country globally as well as in India?
I think this is a very, very important and a very sensitive question. The topic of suicide, it almost has its own stigma attached to it, and there are several myths surrounding this topic. One of them is that if we talk about suicide, we're going to lead to increased suicide, and this is a myth. We need to watch again how we talk about suicide. It is important to have and to raise the conversation about it in order for people to learn that it is preventable. Because again, there's a second myth that suicide is not preventable. People think that, oh, that person was perfectly fine. This act of suicide came as a complete surprise and there were no indications whatsoever for it. But more often than not, that's not the case. And so in order to prevent it, we actually do have to talk about it. But the way we talk about it is very important. It's a little concerning the way there have been discussions on the media surrounding the topic of suicide in the past couple of weeks. And there I feel a little bit like the media, which has again its own important role to play, is not living up to this important role. And we need to now at the community levels, all these lovely students need to talk to one another about how one creates a safe space to talk about prevention of suicide. And but a little follow up to that. People often say the words somebody committed suicide. And again here, because we know that suicide is preventable, we should actually use the words that death by suicide, because committing suicide is a rather blame approach. And I believe that once we do actually accept that suicide can be preventable, then we know that it is death by suicide. It's probably an illness surrounding it and behind it. So, yeah.
Thank you very much. Another question that we have, and you did, talk about it, is that the internet and social media during the times of pandemic have been very, very helpful and very useful, right? So they have, we've, been in touch with everybody we know through that. But there is also an increasing prevalence of gaming addiction, or a lot of, we hear it in the news that somebody has committed a crime so that they can play more. Right. So can you talk a little bit about that? And is that a worry?
Yes, absolutely. I think in these times, while we can encourage the use of digital technology, we need to be careful, because too much of anything is always trouble. And especially with the sensitive information out there that even, for example, children could have access to, we need to ensure that we're not that this isn't just a tool that's an open gate to all types of information. Also because there's so much, as I said, poor information out there, and so we need to use the resources that we know are somehow at best grounded in science, that we somehow know are indeed helpful, and also ensure that we're not too dependent on it, not that we compensate completely with these tools.
Yeah, right. All right. Muskan Mehta has a question, and she asks that can mental health disease be communicable in a social setup? Now, this is something I have heard people ask very often, and since we're talking about awareness, I think it's time we talk about it. Yeah.
It's again a little bit of a misconception that let's say, for example, somebody's depression, if I talk to them about it, that it'll get attached to me. And this makes us a little bit wary of raising the topic. And this is also somehow probably related to the topic of stigma itself. In order to press it in the box and keep the black box shut, we don't want to deal with this at all. But the reality is that you know, it is only through psychosocial engagement that we can get rid of this myth and include people more in the society. So we definitely there. I would like to say that there are various factors that contribute to mental illnesses. I see that in some of the other chats over here, that what are the causes for mental disorders? There are various factors. These include biological factors, genetic factors, as well as environmental factors. And it is the interplay of that that has, you know, the effect of mental disorders or, you know, distress in somebody. But if we can change the environmental effect, and a huge part of the environmental effect is really related to psychosocial connectedness. If we change that, we can really help the other person. And for the transferability of mental illness, that's an absolute myth. This is not a communicable disease.
Yes, thank you. Yes, absolutely. And there are two questions. One is there's no name. It just says Redmi,
Mm-hmm.
and another is Sapna. So Sapna asks whether we can cure mental health at home, or let me rephrase that. Not about curing, but are there any things that we can do so that we just remain more mentally healthy? And another question is that is mental health dependent on physical health?
Mm-hmm.
Right? Yeah.
So the short answers to both these questions is yes. And for the first one, what can you do at home, especially in the time of the pandemic right now? I know that in several areas of India, it's still not allowed to step out, and we have to kind of proactively decide how to make the environment still conducive just at home. And here, I think it's very important from, let's say, cognitive behavioral therapy perspective, to just outline your day. So to ensure that many of you might be working or studying from home, but to ensure that you've actually created a structure in which you could still mimic the way that your days outside of home might have been. So you get changed, freshen up, sit down to work, ensure that you take breaks, ensure that you get away from your Zoom meetings and from your phones and get some fresh air from the balcony or elsewhere, and keep a specific structure. Also try to stay connected socially with friends, make efforts in this regard, eat healthy. And yes, coming to the second question of, is it related to physical health? Stay also active in the biggest possible way, because there is a link between mental and physical health. In fact, no health without mental health. So there is a strong connection of the mind and body. And maybe I think the third or fourth slide, in which I showed how cardiovascular diseases might have something to do with mental health, liver disease might have something to do with mental health. There's a very strong interplay between the somatic, the body and the brain, and we need to ensure that we take care of all platforms.
Aparna has asked us that whether do you think it is important, whether emotional intelligence is as important as intelligence, like IQ. So is EQ as important as IQ, or even more important?
Well, I think it's very helpful to have all forms of intelligence, and I
Yeah.
think that but there are, let's say, for example, strengths in emotional intelligence that could help you in a specific profession more than others. And so the importance, of course, there's importance on in different regards, and but not all of us are intelligent on all scales. And for this, it's just the truth of it. And there are different levels of intelligence needed for different professions. And if we know, for example, that on a specific element we might not be as sensitive to interpersonal skills or something, that we can work on that. So I think it's not really the question of how intelligent we are, but how we can compensate and still optimize our output based on the intelligence levels that we have.
Yeah. Um, There's a question from Dr. Shivani Dhodi. She wants to know whether how, if we can, counsel a COVID infected family member.
Yes.
Like, what is the way in which we can do it?
Thanks. This is a very personal question, knowing that actually a family member of mine, my own mother, was tested positive for COVID. And so I would speak now not just as a psychologist, but also somehow through self-experience, although I'm sitting in a completely different country. I kept asking my mother not only how she was doing symptomatically in terms of COVID, but also how she feels. And in fact, and this is something I would like to take the opportunity to say right here, she said that it feels so weird to be completely isolated and to almost be treated, in a way that I could infect somebody else. This is a very uncomfortable feeling for a person to have with them for 2 weeks or more. And it's important to ask not just about the physical state, about the mental state as well. And another thing, like with every mental disorder, also with COVID, it's important to think of the caregiver. So the key caregivers are very often the ones who take the load of ensuring that everything physically and mentally for this person is going well. And we need to also think of the caregiver as an important person to get some care. So to talk to them about how they are doing, if they need some support, because they, on a long-term basis, caregivers also, well, I'm not sure about corona, there would probably be studies to show, that need to study this. But for example, with dementia or chronic diseases that don't leave us very soon, caregivers are at a high risk of burnout. And this is why we need to look at the patient in a family as well as the caregivers, ensure that physically and mentally both are keeping up well.
I think we have limited time, so we have two more questions that I'd like to ask. There are many more questions, so for those people whose questions haven't been answered, you all can send us an email, and then we'll try to get them answered from our resource person. Yeah. All right. So the last two questions that we'd like to ask is that uh, we've spoken about how prevalent mental illness is, how common they are, and they are on the rise, right? So what are the ways to identify whether I or somebody else has a mental illness, and are there any kind of tests available?
Okay. This again, I would then step back to talk about the dimensional approach. Of course, categories are important, and to think of whether somebody has an illness is helpful sometimes, because if we know that somebody has an illness, it could be that we could get the right kind of medication as well as maybe psychotherapy and support to treat them. But when we think of these things, we also need to be careful about labeling in mental health, given the stigma attached to it. So in some cases, it might be really helpful to give the label to, let's say, a family that the child has, let's say, autism spectrum disorder. It could be really helpful. It could be a relief. And they could say, finally, I can get the appropriate treatment for my child now that I know what it is. On the other hand, if you as the mental health professional realize that, the family will be shattered to find out that the mother of the family is suffering from depression, then what use is this label of? There, it might be really important to, reconsider whether we just prescribe the label and give it. And this might totally, be contradictory or counterproductive in helping the patient as well as the family. So there are several tests out there, man-made tests, on which we determine whether a person is high on a scale and might, have a specific disorder. We have these for various disorders out there, but we need to keep in mind how important labeling is, and in which cases we give a label and in which cases we maybe withhold it.
Yeah, no, I completely agree with that, because we still see people who've been diagnosed in childhood and they still come saying that, oh, I have this, when right now actually they don't have it. They're not presenting any symptoms. So labels stay. So you're absolutely right when you say that, we have to be very careful when we decide to label or diagnose something. And to, wrap up the Q&A, I have one last question. Do you have any personal recommendations for or any future directions for global mental health?
Definitely. I have worked in the field of research basically over the past few years with my PhD, and I think it's very important to bring the science forward. So we do a lot of good work, but if we take a scientific approach on it, then we can leave publications that show us the importance of this. So I would just like to underline the importance of all of you out there, in whether you're working in a clinic or a governmental or a non-governmental organization, to also think of publishing something, be it even in the media or something, so that good programs rise, and those that might not be so grounded in science, that we identify what to suggest to people to use. So I can only say this. And unfortunately, in mental health, as I said, we're still battling mental health against physical health. And so in this regard, if we can do more research that can show the impact of mental health on physical health, we might, as enthusiasts for mental health, make a more convincing case to those who aren't as enthusiastic as us here.
Absolutely. Thank you so much for this wonderful question and answer session. I mean, it was really, I think we got some wonderful answers, and thank you very, very much.
Thank you so much. The pleasure is mine.
Thank you, Dr. Gayatri. Now I request our IQAC coordinator, Mr. Virendra Joshi, to propose the vote of thanks. Mr. Virendra Joshi?
Hello.
Yes, sir.
Am I audible?
Yes, sir, you're audible, sir.
Very good evening to all of you.
Good evening,
It's
sir.
an honor to propose the vote of thanks and acknowledge the contribution of those who worked to organize this event. On behalf of St. P.T. Mahila College and Vanita Visram, I heartily thank the resource person for today's webinar, Dr. Gayatri Salunke, for enlightening us with a wonderful and engaging session. I would like to thank our management of Vanita Visram, Principal Dr. Brajesh Patel, the Academic Coordinator Dr. Imran Surti, the IQAC cell, and all the staff members of our college for their constant support. I would like to acknowledge the work put in by the program coordinators, Mr. Aditya Farsole and Ms. Riya Natkarni from the Department of Psychology for organizing this international webinar. For all the technical assistance, I extend my gratitude to Ms. Bhumi Desai and Ms. Krina Desai. Lastly, I would like to thank all the participants who registered and attended the webinar today. Thank you all. Today we are one step closer to mental health awareness. Thank you all.
Thank you, sir. And to add to that, I would like to extend my gratitude to our IQAC coordinator and vice principal, Mr. Virendra Joshi. And a big shout out to the students of psychology who promoted our event left, right, and center to ensure that we have 880 registrations from over 12 countries. You truly made a difference. That'll be all from our end, people. Thank you all for joining us in our purpose of mental health awareness, and happy World Mental Health Day to all of you. Thank you all. Thank you.